This is the Emergency Medical Minute, sponsored by Health One. What happens when you see these patients and they come in, let's say after a trauma where they've been hit in the eye, and let's say we kind of look at their eye and it's a little dilated. What are you most concerned about? Pressure, right? The pressure of their eye. Okay. And kind of what's most often called an ocular compartment syndrome. Okay. So oftentimes the eye lives in this casing. That's your orbital, that's your orbit. And then that eye itself is a kind of fibrous casing in itself. So that if you have a lot of trauma and swelling around the eye, it can actually put enough pressure on the eye that you get damage to your retina and potential blindness. So oftentimes when you have patients with that, you'll see sometimes, especially if there's bleeding behind the eye will look like it's bulging out. And if they have that and they have decreased vision, you have to be really concerned about an ocular compartment syndrome. So how do you evaluate for ocular compartment syndrome? You check the pressure. And what's the normal pressure for the eye? Less than 20 is a great estimate. Yep, less than 21, and you usually will start getting significant visual symptoms when you start getting to 40. So at 40, that's really an indication to treat aggressively an ocular compartment syndrome. Now, ocular compartment syndrome is different than glaucoma, which glaucoma is like a problem within the eye that the eye is not draining. Ocular compartment syndrome is a problem outside the eye where there's too much pressure on the eye. And it's usually from blood, but can also be from interesting things like sometimes lymphomas present like that, and sometimes other pathology. So what do you do for ocular compartment syndrome? Let's say for the guy who got hit in the eye. A lateral canthotomy. Yep, exactly. So we've done a few of these. Maybe a few of you have been involved in them. But they're this really freaky procedure where we literally kind of on the lateral aspect of the eye will cut the eyelid wider, and then we'll go back and start cutting the tendons that kind of attach the eye to release all the blood. And if your eye pressure doesn't go down, we'll actually take a pair of hemostats and go underneath the eye and then break your orbital floor, all in an effort to try to get all these pressure out of your eye. So, a few of us have been involved in those, which are obviously like you're kind of freaked out because you're by the eye. But in cases like that, it's actually vision saving and surprisingly well tolerated by most people. So, okay, cool. The other trick with that is if you ever have a patient whose eye is super swollen, there's two tricks to open a swollen eye. The first is to get 2 Q-tips and to put them on that swollen eye and to roll them, and that actually will help open it. And then the other one, if it's really, really swollen, you just can't see the darn thing, is get paper clips and bend your paper clips, put them under the eyelid and pull. And they actually serve like 2 retractors. So, exactly. You literally put a hook under the eyelid, pull both ways. You should be able to see absolutely every eye. And 2 things that sometimes you'll see us doing, which look a little freaky, but are important. Okay, cool. We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.